A very warm welcome to everybody today. Thank you so much for joining this nice webinar on our HTA Innovation Laboratory, or the HTA Lab, as we fondly know it. So our HTA Lab provides us a really essential vehicle to help us prepare for the future challenges that we will experience in HTA. So today we would like to showcase some of the work that we've been doing in the HTA Lab over the last few years. And we'd like to talk to some stakeholders and get some stakeholder viewpoints on the impact of the work and also where we can go in the future with the HTA Lab. Please do submit your questions to us for the Q&A session later in the webinar. There's a question box on your screen. So we'd love to hear from you and what you have to ask us and the panelists. Also to let you know, this webinar is being recorded and the recording will be posted on the NICE YouTube channel. So feel free to share that after the webinar. I'd firstly like to introduce our great panel today. Really pleased to be joined by, firstly, my colleague Jamie Elvidge, who is Senior Scientific Advisor in the Science Policy and Research team at NICE and leads our work on the HTA Lab. Also, Jack Turner, who's Deputy Director for Medicines Access at NHS England. It's great to be joined by Jack. We collaborate closely with NHS England on a lot of the HTA Lab projects, and that's essential for us in terms of the impact that the HTA Lab can have on access. And we're also joined by Victoria Jordan, who is Director for Value and Access at the Association of the British Pharmaceutical Industry, or ABPI. And it's great to have Victoria to give that industry viewpoint on what the impact of the HTA Lab is for the pharmaceutical industry and what we can think about in the future. It is really great that in the audience today we have such a wide range of stakeholders joining us, not just stakeholders from England, but from across the world, so those international stakeholders. We also have a wide range of different organisations. We have industry, consultancy, academia, government, patient organisations and healthcare systems. So it's fantastic there's so much interest in this area. And I also wanted to make sure that everybody was aware of the purpose of NICE as an organisation and the work that we do. So our core purpose at NICE is to help practitioners and commissioners in the healthcare system get the best care to patients fast, whilst ensuring value for the taxpayer. And we do this in a number of ways. We produce useful and usable guidance for the health and care practitioners. We make sure we focus on what matters most by prioritising the topics that are going to lead to the biggest impact for the health and care system and for patients and address that unmet need. We provide rigorous and independent assessment of complex evidence for new health technologies, and this is really the area that the HTA Lab supports. We support the health technology assessment of the new technologies coming through. And we know that new technology is coming through at a rapid pace. We're seeing lots of new types of technology that we've not assessed before. We need to be ready for. And finally, we encourage the uptake of best practice. We encourage the uptake and adoption of NICE guidance to improve outcomes for everybody. In terms of the aims of this particular webinar, we want to introduce the HTA Lab, go through what the purpose is. Why do we have an HTA Lab? We'd like to go through some of the past and current projects to really give you a flavour of what we're doing in the HTA Lab. We want to explore the impact of the HTA Lab. This is not an academic exercise. The point of the projects that we do in the HTA Lab is to make sure that we are really having an impact in helping NICE as an organisation prepare for those future HTA challenges. So now I will hand over to my colleague Jamie, who will take us through the what and the why of the HTA Lab.
Thank you, Jeanette. I'm Jamie Elvidge, Senior Scientific Advisor at NICE, and I'm responsible for overseeing the day-to-day running of HTA Lab projects. It's really fantastic to see so many people registered for this event to hear about what we're doing. I'll start by explaining what the HTA Lab is and why it's come to exist, and then I'll talk to you about some of our projects. So the HTA Lab is a relatively new function within NICE's Science Policy and Research team. Nick Crabb, our Chief Scientific Officer, led its establishment. and he described its aims of creating new methods and processes for health technology assessment. That's essentially what NICE does when we evaluate new medicines and health technologies. We know that the pace of innovation in health interventions is incredibly fast, and new methods and disruptive technologies might challenge how NICE works or potentially provide new and effective ways for NICE to work. But traditionally, it's quite difficult for an organisation like NICE to test new ways of working in terms of finding the resources to do that properly, and also without potentially jeopardising ongoing evaluations or risks to decision making. So in 2023, as part of the VPAG investment programme, the HTA Lab was formally set up to improve that situation. It's created a dedicated team within NICE to conduct exploratory work away from the ongoing day-to-day business as usual of our technology evaluations. And this adopts a sandbox way of working, which is something that's been established in various other sectors for several years now, notably pioneered in financial technologies. But this is the first formal use in health technology assessment. So in this exploratory space, we can learn what works, what doesn't work, test new methods and approaches, and collaborate with stakeholders without risks to decision making, without the risk of getting something wrong, for real. And then we can take forward identified solutions in an appropriate and proportionate way. So we're aiming to focus on addressing challenges that NICE's current methods and processes might face when evaluating new, disruptive, innovative health technologies, and also to identify or test potentially beneficial new ways of working, new methods that might improve our evaluations across the board. Broadly, HTA Lab projects fall into one of two categories, exploratory and implementation focused. So an exploratory project will seek to understand a complex issue in close detail, such as an innovative pipeline of new medicines, by identifying the likely evaluation challenges and perhaps identifying a case for evaluating them in a different way. Or it might test a new approach to evaluation that isn't currently part of NICE's routine methods. An implementation-focused project would typically build on exploratory work by, for example, piloting a solution that looks promising and understanding in real detail how we can appropriately embed a new approach into NICE's methods and processes. There are several ways that we're informed about potential challenges and topics for HTA Lab projects from both internal NICE sources and external stakeholders. So we regularly speak to various NICE teams to understand the evaluation challenges that they are facing or anticipating in the future. We're also setting up regular meetings with the ABPI to understand what challenges medicines developers face. And similarly, we regularly speak with other healthcare system partners. In the overlapping section in the middle there, NICE annually requests suggestions for targeted modular updates to our evaluation methods. And if some of the suggested approaches aren't really mature enough to support an immediate change to NICE's methods, then those things might be suitable candidates for an HTA Lab project to investigate them in a bit more detail. NICE is also involved in several multi-stakeholder research projects. These are often focused on the technical methods that underpin the work we do, health technology assessment. And so they might point us in the direction of potentially beneficial new methods and approaches for HTA Lab to examine in the NICE context in a bit more detail. This slide shows the varied HTA Lab projects that have already happened and concluded. So we did some work to explore whether promising medicines with uncertain evidence might enter managed access with the data collection more quickly. We led NICE's position statement on the use of artificial intelligence in evidence submissions to NICE. We supported the system's implementation of virtual inpatient wards, and we supported NICE's evaluations of the first disease-modifying medicines for Alzheimer's disease in 20 years. We've looked at the challenges associated with evaluating diagnostics that affect lots of different care pathways. So that might be a test that provides diagnostic information about lots of conditions at once. And we tested an approach to doing just that. We have 8 active projects underway right now. I'll talk about a couple of these in a bit more detail shortly, but you can see from this slide that there's a real mix of projects. Some of them focus on an identified challenging type of technology or a specific therapeutic area. For example, in the top left, thinking about the challenges that NICE might face when we evaluate individualized therapies. and supporting the evaluations of the very busy pipeline of new treatments for metabolic dysfunction associated steatohepatitis, which is a condition that we haven't evaluated medicines in before. Some other projects explore more cross-cutting challenges that aren't specific to a particular therapeutic area or particular technology. For example, looking at how NICE might consider environmental outcomes in our assessments, how we should capture costs associated with implementing innovative new health technologies into NHS services, and also how we weigh up different kinds of evidence and make decisions through NICE's values framework. Each HTA Lab project is scoped and initiated with cross-NICE involvement and receives senior level support before it kicks off. And then a core HTA Lab team leads on project delivery, including any activities to meet the project's objectives, like identifying and testing a new method. In some cases, we might commission highly technical work to external experts. I think a major part of what we do is get stakeholders involved. We don't just hide away and do this work ourselves. We try to engage with appropriate NICE colleagues from the guidance producing teams and also external groups to really understand the issue that we're trying to address and ensure that we end up with outputs that are useful and acceptable to everyone. From the outset of an HTA Lab project, we think carefully about the implications of where the work might end up. So we aren't conducting purely academic research. We're trying to address very real specific challenges for NICE's medicine evaluations and produce solutions that are going to be implementable and underpinned by solid research work and stakeholder input. Now, I'll briefly talk about a couple of our live projects in a bit more detail to give you an idea of the kinds of questions that we're seeking to answer and the activities that we conduct to do that. Firstly, we're examining how the rapidly growing pipeline of individualized therapies might challenge NICE's evaluation processes. So we may see a large number of individualized medicines for lots of relatively small indications in the near future, and they could be developed very rapidly, but have uncertain or atypical evidence bases. So we're trying to understand what that pipeline looks like, how many of these medicines are in development, what do their trials look like, what conditions are they being investigated for, and at the same time we're reviewing instances where such technologies have already been evaluated in the past, either in economic analyses or health technology assessments, and we want to draw those two fact-finding elements together with some really focused stakeholder engagement activities to understand, is there really a case for NICE to do something different when it comes to evaluating these kinds of individualized therapies? Now, that may identify a case for change, perhaps something relating to platform technologies where similar individualized therapies might share common development processes or common features, and we might come up with a new approach for subsequent, more detailed and focused testing. Alternatively, this project might conclude that there's no strong case for change and actually NICE's methods remain appropriate. Secondly, we have a more cross-cutting project examining how generative artificial intelligence might be used to support economic modelling, which is usually a core component of the evidence that's considered by NICE during a technology evaluation. So developing and reviewing cost-effectiveness models is a particularly time-consuming and resource-intensive task for all involved, and we'd like to understand whether the advent of these innovative generative AI tools might provide a new method that allows some of that to be done more efficiently. So we're reviewing any such uses to date, we're engaging with experts and stakeholders to understand the risks and opportunities, and we're directly collaborating with thought leaders in this area to conduct some new targeted case studies where we're actually using generative AI to do specific tasks relating to economic modelling and learning about how that goes, learning as we go. So this might identify ways that NICE could evaluate medicines more quickly or better. And if there is indeed promise for this use of AI, we'd then like to generate some early best practices to support this way of working in the future. Briefly, I'll also mention a couple of topics that are on our radar that we've been alerted to for potentially impactful future HTA Lab projects. Firstly, we are planning to take a broader view of how the growth and advancement of AI might affect NICE and understand how it might support our evaluations and allow us to do things better, but also where we may need to adapt. Another, where we think that increasingly innovative health technologies are increasingly likely to be underpinned by different types of evidence, things like laboratory-based data or computer-simulated data. So those are things we don't typically see in evidence submissions to NICE at present. So we'd like to explore how we'd consider those things if they were submitted to us, and identify situations where they might be a particularly useful addition to traditional evidence from clinical studies. So as I mentioned earlier, all of our projects do require engagement to ensure that we're addressing the right challenges and reaching acceptable, implementable outputs and solutions. So please do take a look at the HTA Lab website, and please contact us through the email address on the screen if any of our current or future projects are of particular interest, or if there's a novel challenge that you think we should be looking at. Thanks for listening.
Thank you ever so much, Jamie. That was a fantastic showcase of the work that we've been doing in the HTA Lab. We're now going to hear from some internal and external stakeholders on what their view of the HTA Lab is and the impact on their work.
I play an active role in horizon scanning here at NICE, and I think when we look into an ever-growing pipeline of medicines which are either challenging to evaluate or complex to implement, I think it's really important that NICE is on the front foot and proactively tackling these issues. I think HTA Lab is a fantastic initiative which provides NICE with the mechanism to engage on either whole therapeutic areas, so things like dementia or MASH, or look at methodological challenges linked to HTA evaluation. Good policy making has an academic spine, it's evidence-based, and crucially is forward-looking. And I think HTA Lab gives NICE that ability to ensure it's always on the front foot and is delivering world-class services by engaging with key stakeholders either domestically or indeed internationally. And it's only really by tackling those challenges up front we can produce timely, high quality and relevant guidance to the health and care system. And I think over the coming years, HTA Lab, and most crucially its outputs, are going to be core to achieving this objective.
The HTA Lab, I think, is a really key part of developing timely and high quality guidance at NICE. By using our enhanced horizon scanning approaches, we can identify the topics that are the topics and the innovations that may need a slightly different approach to NICE's work. So be that kind of new methods, new technical approaches to assessing those technologies, or new policy solutions, so that we can make sure that we're producing robust assessment of the clinical benefit and also the value for money of these new innovations in the NHS. So I really see the HTA Lab as making sure that we are keeping at the forefront of our methods and processes, and that those methods and processes really are keeping up with the pace of the new innovations that we're seeing coming in the pipeline that NICE will be evaluating. So we need to be keeping NICE at the forefront of the HTA approaches and producing useful and usable guidance for the system. And as I said, the HTA Lab, I think, is a key part of successfully doing that.
Well, I think the HTA Lab can provide such a valuable overview of what's going on in technology appraisals, because it's incredibly complicated, and I think there are two big challenges in technology appraisals. One is the consistency of decision making across different committees, and the other is how can NICE be responsive to changes in the landscape and new issues which arise. So the work that I've been helping a bit with recently through the HTA Lab related to the use of real-world evidence in technology appraisals is in a way a case in point. The NICE is very committed to the use of real-world evidence, and it collects real-world evidence through managed access, but the evidence is that committees were not particularly using it effectively, and that's probably related to there being no really specific guidance to committees about how they should use it. So where the HTA Lab project has really contributed was in, first of all, commissioning some specialist work from the NICE Decision Support Unit to look at appropriate methodology for utilising real-world evidence in technology appraisals. And then going on to the second phase into developing actual guidance to committees about when and where they can best use real-world evidence to best effect. So in essence, I think that this work that the HTA Lab has been doing really addresses those two key challenges that I mentioned at the beginning, the issue of consistency across appraisals and also the responsiveness of NICE to the changing landscape.
We're now going to hear from Jack Turner from NHS England to give us that payer perspective on the work of the HTA Lab. Jack, over to you.
Thank you very much, and thank you for inviting us to be part of this panel today. So, by introduction, I am the Deputy Director for Medicines Access in NHS England and work for a directorate called Medicines Value and Access, which has the task to balance some competing objectives as kind of under payer policy, if you will, of ensuring that we are speeding and getting access to the latest clinically and cost-effective medicines as fast as possible, continuing to incentivize industry to bring new innovations to market, whilst also ensuring best value for patients and the taxpayer. And doing that is incredibly challenging, but inquiry really requires us to work in an integrated and harmonious way. And that's one of the fantastic things about having initiatives like the HTA Lab, because it allows us to work in collaboration and actually ensure that we are continually evolving our processes, making sure that payer processes and HTA processes are interconnected, and making sure that we're not seeing any unnecessary delays in the HTA decision. Next slide, please. Thank you. I feel like my internet may be struggling slightly, so I'm just checking everyone can hear and see me still. Yes, brilliant. From a payer perspective, we find initiatives like the HTA Lab incredibly valuable because we're seeing an increasingly complex pipeline of moving to market. Some of these are treatments that are incredibly novel. They might be first in class, or they might be N of 1 therapies that have very small patient populations and therefore very limited clinical trial data when they come to market, which makes the assessment of value incredibly challenging. On the other extreme, we are seeing increasingly a number of population health interventions that are coming to market, which have the potential to offer significant aggregate quality gain, significant patient benefit at scale. But the opportunity that they provide is also matched with the complexity of delivering such treatments at pace and scale in terms of the service transformation that's required to actually make these things work in practice, which is a challenge because often these treatments are the things that demonstrate the highest potential to deliver on unmet clinical need. I was thinking this morning about some of the examples that might fit that to bring it to life, and one that I should say is now available on the NHS is a product called Zolgensma, which was a GP for treating spinal muscular atrophy, a rare and often fatal genetic condition affecting motor neurons. Now, when it came through for assessment, it has a high cost, clinical evidence limitations due to the rarity of SMA. So you've got very small patient population, which makes a cost-effective assessment for colleagues in NICE really challenging. Again, we have lots of service delivery hurdles to overcome when that came to market. Specialist centre infrastructure is required due to the rarity of the treatment. You need gene therapy ready infrastructure to deliver it. You need cold chain storage and handling. And there's commissioning and reimbursement issues around that as well. So it's these types of products that we're increasingly going to see coming through, where we need to explore novel approaches to ensure we can bring them to patients as quickly as possible. Can I have the next slide, please? And that is really why having the HTA Lab is crucial. As colleagues from NICE have said, it creates a safe space for us to work, not just with NICE, but across all system partners to try and address the increasing complexity and rapid evolution of healthcare technologies. And we work with NICE not just on methods and processes, but ensuring that their guidance and guidelines remain useful and applicable to the healthcare system, which is particularly important for delivering those complex technologies. And I think, as colleagues have said, having a sandbox approach is key to that. So having a controlled environment where we can test new ideas and methodologies to determine whether they will work in practice before they become precedent is really, really key to successful collaboration in this space. And ultimately, the HTA Lab allows us to ensure that both the value add processes facilitate that timely access and equitable patient adoption at pace and scale. Can I have the next slide, please? So there's a whole bunch of initiatives that the HTA Lab have historically undertaken, and I think there's a lot of that will go into the future that will really benefit the healthcare system. I just wanted to call out a few areas that we think are particularly important and exciting moving forward. So one is using this as an opportunity to explore new commercial mechanisms. We're continually trying to interconnect and evolve our payer processes alongside NICE and make sure they work well together. We'll be doing much more work, I think, in the future under the HTA Lab to ensure that our commercial mechanisms continue to speed up patient access and simultaneously reduce the cost to industry where appropriate, while continuing to achieve value. So again, trying to balance those three competing priorities out as best we can. About 5% of medicines launched in England every year, we find, don't have sufficient evidence for widespread use. But instead, we have the opportunity to recommend those products into a managed access period where there is appropriate patient access while additional data is collected. There'll continually be opportunities under the HTA Lab to collaborate to think about, are our managed access positions correct? Need to have more simplified or streamlined approaches to managed access, but also usually where evidence is uncertain, what can we do together that will allow for greater assumptions to be made in economic modelling to accelerate access for patients, and how can we use real world evidence from the healthcare system to really support effective and consistent decision making. That will be key moving forward. Individualized therapies, we're seeing more of those coming through. And we're really grateful that under the HTA Lab, NICE are developing practical approaches for assessing those individualized therapies that ensure that evaluations remain comprehensive and reflective of real-world complexities. In parallel to that, NHS England are actively exploring the development of an operational framework for delivering such treatments to the NHS. That's going to include considerations for commissioning services to ensure the necessary infrastructure is in place to support the safe and effective use of these therapies. But where you have very, very small patient populations, these things challenge additional infrastructure, challenge additional assessment and payer processes. So thinking that stuff through together is vital. The last thing I would call on is integrating service costs into HTAs. I talked about it at the top of this presentation, where you have individualized therapies or large population health treatments. That creates a challenge for service costs. And we're working closely with colleagues in NICE to think about how those costs of new infrastructure, training and service delivery models might be more directly integrated into HTA assessment. So that also is really key. I will stop there and pass back to you, Jeanette, but thank you very much.
Thank you so much, Jack. That's brilliant. It's really important that NICE is able to collaborate effectively with NHS England to really maximise the outputs of the HTA Lab projects and think about not just the implications for NICE, but the implications downstream for the healthcare system and the access and uptake piece as well. Equally important is our ability to collaborate with industry so that we can see what's coming down the line and work with companies on particular case studies in our sandbox environment. So now we'll hear from Victoria Jordan from the ABPI. Victoria, over to you.
Thanks, Jeanette, and good morning or afternoon or evening, depending on where you're listening from. I'm Vic Jordan. I'm Director of Value and Access Policy at the ABPI. We are a trade association that represents the innovative research-based pharmaceutical industry that is operating in the UK. So I'm going to spend a few minutes giving an industry perspective on the NICE HTA Lab. I'll start with why we think it's important that there is innovation in HTA, then share how industry is supporting the HTA Lab through the VPAG investment programme, and finish with some reflections on what I think NICE will need to do to ensure the HTA Lab is successful. So I could have my next slide, please. So stating the obvious, really, but it's really important that NICE has the space to innovate. Ways in which we generate, analyse, report evidence change, and so does the innovation itself that's in the pharmaceutical and the medical technology pipelines. The pharmaceutical pipeline has all sorts of novel treatments in. We've got things like mRNA therapeutic cancer vaccines, gene transfer therapy vectors for diseases like Duchenne, RNA-based technologies for elevated lipoprotein levels, stem cell therapies for CNS disorders, novel mechanisms of action for antidepressants that treat things like major depressive disorder, the next generation obesity medicines with easier administration and the ability to treat and prevent several conditions. And this is just a snapshot, so identifying the technologies that NICE's existing methods and processes may not be able to be optimally used for evaluation will be really important. So the industry has always advocated for NICE to have sufficient capacity to be able to evolve its methods and processes on top of delivering its guidance development work programmes, which we know are extremely busy and take a lot of their time and resource. And actually, this was one of the key rationale that was given to the industry when NICE moved to a cost recovery model and fees for appraisals were introduced. Why is it so important? Primarily because an approach that enables continuous improvements can help support timely access to innovative healthcare technologies, can minimise the risk of delays or even no access decisions when a new type of treatment enters the NICE work programme. First-in-class medicines, especially those that are quite different from what NICE has previous experience in evaluating, have often faced challenging and lengthy appraisals, and we've seen delays happen and patients waiting for really important treatments. There's also a need to continue to test whether NICE's methods are allowing for the full value of these technologies to be considered and rewarded, something we would argue that is not yet being fully done. Another benefit of identifying and exploring technologies that will likely test the existing ways of working is it allows for early identification of other potential issues beyond the evaluation. So as Jack was speaking to, what else might need to be considered from a payer and an implementation perspective? Are the right screening and diagnostic pathways set up? Does the care pathway need altering to support optimal treatment of the patients, for example? Another good reason to continue to innovate in HTA is to support a more efficient use of resources within NICE, but also those who contribute to the evaluation process. We know NICE's capacity is limited, but so is that of its committees, the clinical and patient experts that are involved, and the companies that are engaging with the process too. So if challenges can be preempted and something can be done about them ahead of NICE doing the evaluation, then it will lead to a smoother and quicker process for all that are involved. And lastly, I'd say that meaningfully innovating, and I don't mean just tweaking around the edges here, but actually introducing new approaches, can demonstrate NICE's thought leadership on the global stage. We know that several markets look to NICE and what it's doing. So changes that are made really shine a light on how supportive the UK is or isn't being in introducing innovation into the NHS. And I say the UK, they're acknowledging that Scotland has its own HTA process. If we go to the next slide, please. I'd say that industry is really pleased to see NICE set up the Innovation Lab. We thought it was an initiative that needed to be prioritised and fully resourced to be successful and to be able to achieve those benefits that I've referred to and that Jack, Jamie and Jeanette have been speaking to as well. So as part of the negotiation of the current VPAG, for those that aren't familiar with the acronym, that's the Voluntary Scheme for Branded Medicines Pricing, Access and Growth, which is an agreement between the government, NHS England and the ABPI on behalf of the pharmaceutical industry, which seeks to support patient access to medicines and the financial sustainability of the NHS and the UK life sciences sector. So it was agreed for the first time that a VPAG investment programme would be set up to financially support a number of projects that all of the signatories of the scheme felt should be prioritised to strengthen UK competitiveness in health and life sciences and drive innovation-led growth. The VPAG investment programme is providing additional funding from scheme members to invest in projects across all 4 UK nations over the course of the scheme. It's a 5-year scheme that started in 2024. And the projects that are being supported fit within the 3 buckets that are on this slide across clinical trials, manufacturing and HTA. HTA is a bit of a loose definition. Some of the projects within this bucket aren't directly HTA related, but they are seeking to improve processes that relate to access to medicines. Within the HTA projects, the investment programme is providing multi-year funding to support resourcing for the NICE HTA Lab. And it should be clear this funding is hands-off. We hope industry is seen as a valuable contributor to the projects, but we collaborate in the same way as all stakeholders. I think what this really shows, it's a great opportunity to be using some of the VPAG money for projects where there's a shared ambition across government, NICE, NHS England and the industry. If I could have the next slide, please. So whilst the HTA Lab is still in its infancy, especially in its current form, I thought I would finish with a few reflections and things that, from my perspective, will be critical to its success. So I was thinking about why it's so important to have the lab, an initiative like it, and thought back to before it existed. Back in 2018, the first histology independent or tumour agnostic therapies hit the NICE work programme. And these were really an example of a paradigm shift in cancer care where these medicines were able to target cancers expressing particular genomic alterations, regardless of where in the body the cancer originated. The evidence bases for these medicines were therefore really quite different from those NICE was used to seeing for cancer treatments, and the application of the existing methods was not clear, including how, at the time, it was the end-of-life modifier that NICE had in its methods, how that would apply. So the appraisals themselves were inevitably incredibly challenging, and I think the HTA Lab now offers the opportunity to identify such step changes in innovation early and get ahead on preempting and, where possible, resolving those challenges ahead of time. The second example I reflected on was the first project that the HTA Lab took on, which was exploring the idea of a process for rapid entry into managed access. So rather than doing a full NICE evaluation up front, could a more pragmatic approach be taken to making managed access decisions where it's clear this interim funding mechanism will be needed? And Jack was referring to some of this as well. At that time, this project didn't result in the development of a new approach. And my reflections are that I don't think it was clearly scoped at the outset or sufficiently connected across the relevant stakeholders at the outset. Whilst the ambition was there, I think the HTA Lab wasn't set up in a way that enabled to be clear on the following things which I've identified as being needed for the projects to be successful. 1, involving stakeholders in identifying and prioritising the projects, as well as in the projects themselves. So as Jamie mentioned, NICE is starting to set up mechanisms to do that. And I think that's really positive, and the ABPI is looking forward to engaging more regularly and getting input from our members to help shape NICE's work programme. Secondly, having a clear scope and where NICE might seek to take the projects afterwards. I think it will be important to give stakeholders this clarity and reassurance if NICE is going to get buy-in early on. So I'll give an example of that. Currently, there's a project going on looking at MASH, technologies that are going to be treating MASH. And I think having clarity in terms of the scope of what that project will do, what changes it might result in for manufacturers with those technologies in their pipeline is really clear. Thirdly, ensuring there's a policy lens over the work and that it's not too narrowly focused on NICE's methods and processes. I think it can be quite easy to get into the technical aspects, but actually we need to make sure that there's a broader perspective that is being sought when NICE is doing these projects. And by this, I mean, NICE doesn't operate in isolation. So considering how the project fits within the broader policy environment is important. And then lastly, NICE should seek to be transparent, not just with the project outputs themselves, which are helpfully all put on the HTA Lab website, but what is working well and what can be improved so that the lab itself can continue to evolve and improve. So from the list of past projects that Jamie presented earlier, what did NICE do differently off the back of those and what impact did they have? So I hope that provided a helpful view from the industry perspective, and I'll be very happy to take any questions that you have during the Q&A. Thanks, Jeanette.
Thank you so much, Vic. That was great. It's great to have that industry insight and some good advice for us to help us move forward with the HTA Lab as well. So now we're going to hear from some other external stakeholders to NICE who have had interaction with the HTA Lab in some form and hear what their views on the work of the HTA Lab is.
So I would say that being a part of this HTA Lab as a collaborator is an exciting opportunity to explore cutting-edge approaches in health technology assessment for us. Our team, as you mentioned, has been focusing on the use of Gen AI in advancing economic model development, adapting these models to different countries, and also validation of these models. Now, these advancements have a potential to dramatically accelerate the pace of HTA and make our methods more efficient. And what I think sets HTA Lab really apart is the collaborative environment. And NICE has created a truly unique platform that brings together experts in technology, experts in the methodology, and people who are applying these methods together. And this dynamic exchange of ideas help us push the boundaries, refine our approaches, and contribute to the advancement of the HTA practices. And we're very grateful for this collaboration with you all. Thank you.
Participating in the research project at the HTA Lab was very rewarding. We know that NICE's methods are viewed closely and often mirrored around the whole world, so it's especially exciting to be part of the early stages of developing these methods. The HTA Lab itself covers new areas of research, and it's had to work fast to adapt to changes in the healthcare environment. And as the researcher, being involved at this cutting edge of the methods in decision making and knowing that we're advancing the field of knowledge gives a fantastic sense of purpose. I really enjoyed the systematic approach towards creating the methods. Things start off very broadly and we discuss a whole range of possible implications, maybe the feasibility of that work as well. And then we start to focus on the areas that really matter. And we begin to develop a tangible and robust solution to things. And the team at NICE organised that aspect really well to focus things onto the stuff that really makes a difference. And ultimately, I think that as a role, using healthcare funding wisely is something that impacts on everybody. And so it's been a fantastic feeling to know that these methods are going to make a positive difference to potentially many tens of thousands of people.
Very much welcome. I know generally NICE aims to keep its processes as up to date as possible. This has included regular methods reviews, leading up to, for example, a move towards developing a proportionate approach to technology appraisals. But there are issues remaining with the speed of developments coming forward and the volume of assessment and evaluation work that's required to deal with that. Patient care involvement is highly valued and is important on two levels, I think. The patient voice in the form of first-hand evidence and experience is essential to the evaluation process. But equally important is that patients themselves are being made aware of the challenges of healthcare provision. We need to ensure that patients contributing to the evaluation process with their first-hand experiences are at the same time fully informed of the compromises required when allocating limited resources when health technologies are developing so fast. Having a dedicated resource or safe space or whatever we choose to call it could well be a useful addition to the existing health technology appraisal process. Just increasing the capacity of the existing system of health technology assessment will not be enough to keep pace with the speed of medical developments. At this early developmental stage, the outcomes of exploring a new dedicated resource will be unknown. This is obviously both its challenge and opportunity. We don't know what the HTA Lab might come up with, but I'm sure that patients would definitely want to be part of the process and to know that health technology appraisal methods are as up to date and forward thinking as possible. Obviously ensuring along the way that guidance is useful and usable, particularly for complex and disruptive technologies.
Great, I hope that was interesting to hear from those stakeholders. We're now moving to the Q&A part of this webinar. Unfortunately, Jack has had to leave for an urgent meeting, so he sends his apologies. But we have Jamie and Vic and myself. We've got some great questions coming through, so thank you to all the audience members who've been sending those through. We've got, we're going to start with some questions because we've got quite a few questions coming in on who can get involved in HTA Lab projects and how we collaborate with different types of organisation. So we're going to start with one around collaborating with clinical academics and also patient organisations. So we're always keen to collaborate with different types of organisations where they're relevant and a key stakeholder in that particular topic. So I'll go to Jamie on that one, if that's okay. Jamie, can you talk about involvement of academics, particularly clinical academics, and also if we've got any examples where we've involved patient organisations before?
Yeah, certainly. So we want to, at the outset of an HTA Lab project, the team involved kind of maps out who do we need to speak to, who do we need to get involved in this to reach an answer that is meaningful, potentially acceptable. There's lots of examples where that goes beyond system partners and in industry. So for the MASH the project that was introduced before for the treatment of MASH, metabolic dysfunction associated steatohepatitis, we know that there's a really busy pipeline of medicines in that space, and that's not a therapeutic area that NICE has conducted a health technology assessment in before. And so we knew there's a lot that we know there's a lot that we don't know about that condition, about that pipeline. And so the initial piece of work that the team undertook was a really detailed clinical landscape review to understand what does that pipeline look like, what do those trials look like, and what does current practice look like for the treatment of MASH. Now that involved, we identified, we reached out to professional bodies and clinicians that have been involved in NICE work in the kind of liver space before now. We held one-to-one interviews, we held joint clinical workshops, and also as part of that project, we reached out to the British Liver Trust as well. So we had some patient advocacy involvement there. In terms of academics, one of our other live projects is exploring how real-world data that are collected as part of managed access have been used historically in NICE assessments when a medicine goes through managed access, some data are collected and then gets reevaluated, reappraised. We've kind of reviewed what that looks like, how are those data being used? And we've worked with the University of Sheffield to understand, to look at that in detail and understand how could those data be used differently? Are there circumstances where they should be given more or less prominence? So it's kind of project specific, that kind of whether they are very clinically focused tasks, very academically or technically focused tasks. But at that initial stage, we kind of map out who do we need to speak to and how do we get in touch with them. Also worth pointing out that we do put on our website new projects as they initiate. So very happy for any stakeholder from kind of any stakeholder category to reach out to us and say, this is interesting to me, I have something interesting to contribute here, please get me involved.
Fantastic. Thanks, Jamie. And I say to all stakeholders, if you want to register your interest for future projects as well, then email us at the htalab@nice.org.uk email address, and we can sort of register your interest. And if a project comes up in your area of expertise, then we've got you on our books already. Similar question has come through, but around collaboration with the pharma industry. So what interactions has the HTA Lab had with industry, and what are the key issues raised by pharma industry representatives? So Vic, if we can go to you first and really think about what are the key issues that have been raised by pharma. What do you see that's on the horizon as well that the HTA Lab needs to be thinking about?
Yeah, thanks for that question. So, I mean, so far the HTA Lab team has been reaching out on individual projects, so using the ABPI's member network to gain relevant input from stakeholders that have interest in the specific projects that the HTA Lab is doing. But as Jamie mentioned earlier, we're going to put in a sort of more regular mechanism for the ABPI to collect insights and feedback and to share that back with the HTA Lab team to help inform the selection of future projects and what we might need to be prioritising. So we're going through an exercise at the moment to really look at that from a pipeline perspective, and in particular looking further out than the usual sort of 2 to 3 years that is usually done from a horizon scanning perspective, so that we can really have a grasp of what those sorts of technologies are that are potentially going to test NICE's methods really quite early on and get ahead on those. So I'd say, that exercise is ongoing from a sort of specific technology type perspective. Some of the key issues that I'd say have been raised so far are more around the things that I was talking to in my presentation. So things like, the scope and how can companies interact when things are actually already happening, but also within a project in the lab. So AI, for example, the HTA Lab is exploring AI, different uses of it, how they might impact on NICE evaluations, but also companies are using AI and exploring the uses of it as well, both at the global but also the UK affiliate level. And it's a bit chicken and egg there, isn't it? There's question marks as to if AI has been used. So, for example, to do systematic literature reviews, will that be acceptable from the submission perspective? Will there be additional work that we need to do on top of that to do a non-AI version of it? So it's sort of things like that that are traveling in train, because things are being innovated on, but also NICE still has to, continue with its work program. So questions kind of crop up around the kind of here and now type issues. And I guess the sort of specific technology type stuff will start filtering through with that process that we're putting in place.
Great, thanks, Vic. And that longer term horizon scanning is going to be so useful to us in the HTA Lab. So thank you for that. Jamie, maybe you can give us some examples of where industry has worked closely with the lab. And if you can also take the question around how the sandbox approach works, how do we actually test innovations in that sort of real life but protected space?
Sure. So a couple of instances where industry's input has been really key and useful. So actually the one that comes most strongly to mind, Victoria's just mentioned the generative AI project that we're undertaking. We're actually in the midst of a kind of multi-stakeholder workshop series where we are talking about the use cases that we're developing. We're also getting that flavour from a range of stakeholders, but particularly industry and particularly economists and data scientists around how can generative AI support economic modelling. And based on the engagement so far, the industry input to that is really crucial and really adding. This is clearly a hot topic for lots of stakeholders. So the industry input to that is going to be really helpful in steering us towards some good outputs and perhaps some best practice recommendations. Additionally, one of the projects that's recently concluded, where we examined how NICE might evaluate health technologies that affect multiple indications, particularly diagnostic technologies. We very recently, that's hard to do. That requires a lot of resources. If a technology affects lots of care pathways, 8 care pathways, you might need 8 analyses, 8 economic models, which is very resource intensive. So we identified there might be some work you can do up front to prioritize and focus your modeling efforts and your evidence generation efforts. So we've actually recently concluded a project where we piloted that approach, tested what it might look like, and that involved collaboration with the company. We wanted to identify a health technology to place that work in context. And so that it was really crucial that we were engaging with a company in that project as well. The sandbox approach, thanks for the question on what is the sandbox approach in practice. So we think of it as essentially a way of working or a way of framing our work. And the crucial thing is that the projects that we undertake here are isolated from our ongoing appraisals, our live appraisals. And I think it's really important that we set the boundaries of that at the outset of a project. The work we do, the things we're looking at are by design exploratory, and they don't necessarily have implications for the appraisal that's starting next month. We're testing here, we're seeing what works and what doesn't. So I think setting that boundary from the outset is really important, I think, in terms of embedding the sandbox way of working. It's actually been born out of our involvement in an EU-funded Horizon 2020 funded research project called Next Generation Health Technology Assessment, where we collaborated with other HTA agencies from across Europe to understand this sandbox approach and understand whether there is value of using that way of working in health technology assessment. And we kind of concluded that the risks of making incorrect decisions in what NICE does in health technology assessment are high, but the pace of innovation, there was a real gap for this space, this isolated space, to just test and learn and make sure we're not, as an organization, embedding new methods too quickly before they've been tested, before we understand the implications, or on the flip side, being too slow and not innovating our methods when we really should be.
Thanks, Jamie. And Vic, I wonder whether you had any viewpoints on the sandbox approach and any advice for the HTA Lab on that?
Yeah, I think it enables some creativity and stakeholders that are involved to be open with their input and things. But I think the challenge with it is the translation then into what does it mean, and what is that output then going to go forward to, and what is NICE's appetite for change as well, which is why I was saying that I think the scope has to be clear. So yes, setting that boundary that's what the exploratory part of the project is doing, but being clear then in terms of how NICE might look to take it forwards. Or not, and what kind of decisions there will be made, and what sort of review would be made in terms of making those decisions. Because I think that helps with people engaging. Otherwise, it can risk just throwing up a lot of other questions rather than necessarily just focusing on the topic at hand.
Thanks, Vic. And that's really useful. I think relates to another question that we have. The final question we'll take is around feeding the learning into our technology evaluations. And there's many aspects of that in terms of, as Vic has already pointed out, the scoping has to be very clear in terms of what we're actually planning to do in the project, and thinking at the beginning how that's actually going to translate into impacts or changes for the technology evaluation. It's also about bringing in those internal stakeholders within NICE into the project. We have the people who are working at the front line on the guidance involved in the project in the working groups and the steering groups for each project as well, and then doing that interim evaluation at the end of each project on how the results of the project can then move forward. And there's different routes. It could be education and training sessions for the guidance producing teams, if it's, for example, been looking at challenges in a specific disease area, or it could be lead to an actual modular update and actually changing our methods and processes in the long run. So there's multiple different mechanisms that we use, and it is an area that we're going to be working more closely on to make sure we're getting right, and we're looking at evaluating each project as well to make sure that we're not just picking the right topics and doing the right work, but that we're implementing and making the most of the projects as well. Great. Well, that brings us to the end of our Q&A session. So I'd like to say a massive thank you to our speakers, to Jamie and to Victoria, and also to Jack, who was a presenter earlier. It's been absolutely fantastic having you on. We really appreciate your input into the webinar. So thank you very much. And I'd also like to say a final thank you to all of you who've joined the webinar today. Thank you for your attendance and your engagement and the great questions. It's fantastic to see so much interest in this topic. We've had a huge number of people sign up, as I say, from across the world. And I think that really demonstrates the importance and the uniqueness of the HTA Lab approach at NICE. And we hope that a similar kind of sandbox approach will be taken in other HTA bodies in the future. We hope to be able to keep engaging with our stakeholders, so please do visit the HTA Lab website. Please do email us on the htalab@nice.org.uk email address, and please do share the recording of this webinar once it has been uploaded to the NICE YouTube channel. It will be emailed to you all everyone who signed up for the webinar. So please feel free to share that with colleagues who are not able to join us today. And that leaves me to say I wish you all the best for the rest of your day. Thank you for joining. Goodbye.